Hello parents, welcome back to Ask Dr. Wagner. I'm here with Dr. Janisa Wagner, a pediatrician. Last time we had a great conversation about fever and I learned a lot of new things about fever, a lot of misconceptions. Today we're going to talk about colds, something we all live with every single winter and sometimes during the year. So we're going to talk a little bit about colds today. Thank you so much for joining us, Dr. Wagner.
It's a pleasure being here.
So mucus color. Does the color mean something? Is it automatic? Go run for the antibiotics. What should I do?
Yeah, I think sometimes people worry if the kids get some yellow or green mucus that means that it's time for antibiotics. That's sometimes perpetuated by some of the preschools. They say they can't come if they have green or yellow mucus, but it really is a misconception because it's normal to have a little bit of that green or yellow at the end of a cold, and as long as the child's otherwise getting better from things, it really doesn't mean anything. The time to be a little more concerned is, if your child has had a cold for 7 or 10 days or more, and then they start getting worse instead of better in some way, then that's when you might want to be taking them to the doctor. And some signs they're getting worse is like if they start all of a sudden getting really tired or dragging, and they might have some really thick stuff coming out of their nose, possibly might have a little face pain or headache or be getting a fever or something like that, or coughing more at night. Those are signs, that the child should be seen at that point. But other than that, you don't have to worry about just the color of the mucus. It doesn't mean much. One thing you can do is you can try using nasal saline drops or nasal saline wash to help rinse out the nose, and that can help keep those secretions loose and possibly stave off a sinus infection as well.
What are some other ways to treat a cold? The classic chicken noodle soup and all that?
Yeah. So one thing is that I want to clarify is that antibiotics don't help a cold. So because colds are caused by a virus and antibiotics treat bacteria, and so a lot of people think, wait, my kid's having a cough, I need an antibiotic, and some doctors, perpetuate that by just writing a prescription. But like I said, if they don't have a lot of the symptoms that I talked about a minute ago, they aren't going to need an antibiotic because it is just a virus causing it. And also cough and cold medicines have been found in kids not to help, and they can have side effects. So we really don't recommend cough and cold medicines for children especially. But you can try giving them honey mixed with a little warm water or herbal tea. That can really help soothe the throat. And of course, you don't want to give honey under the age of a 1-year-old. We don't want to do that. But other than that, honey is very good for that. And another thing is that garlic can help fight off infections. Soups are good too. I think anything that's sort of soothing to the system is fine too. But definitely eating more garlic, if you can do that, giving your kid more garlic can help to fight off infections too. So that's a good thing. Like if you have a newborn baby, even if somebody says that it's allergies that's causing all that runny nose, say, well, that's great. Once you get that treated, then you can come around with the baby.